Good evening. Plans for health emergency services across Worcestershire are not safe, a panel of independent experts has concluded. However, a report by the West Midlands Clinical Senate today backed some of the official plans to move some maternity services and emergency surgery from the Alexandra Hospital at Redditch to Worcestershire Royal Hospital in Worcester. But they've raised concerns about plans for children's services. Meanwhile, doctors from Redditch and Bromsgrove are demanding that other options are properly considered. Here's our health correspondent, Michele Paduano.
In 2006, campaigners fought to save services at the Alexandra Hospital. In 2015, that fight is still on. But now GPs representing people in Redditch and Bromsgrove say enough is enough. They need to look for better solutions in the interest of their patients, and that's away from Worcester towards Birmingham.
We all met and have decided that this is a watershed point, that we must take some action, and we've now received letters from all the practices in Redditch and Bromsgrove supporting us in doing so. They feel that there needs to be a change of direction at this point.
It's because a panel of experts, the West Midlands Clinical Senate, say the current plan to leave adult emergency services without surgery is unsafe. They also fear removing children's services to Worcester could lead to extreme pressure on beds. And in extreme emergency situations, there might not be enough key staff to maintain safety. So GPs on the governing body for Redditch and Bromsgrove commissioners are thinking the unthinkable.
In order that our patients, instead of having to be taken down to Worcester Royal, where the site is under very significant pressure and is poorly performing, they would be able to be taken up to the QE if they were unable to be managed at the Alex. And our patients are telling us that that's what they would prefer. Our membership practices have been very strong in their support that we must work up all possible options.
It could lead to the breakup of the Worcestershire Acute Hospitals Trust and the loss of some specialist services for patients in South Worcestershire. The person in charge of finding a solution believes that the problems can be ironed out and the public will be consulted in the autumn.
I think we have to remember that the Senate the report was actually undertaken at a point in time, and obviously some of those agendas have moved on since, and which have been widely reported. So we accept that obviously the clinicians' views and clinician opinions may vary, but we need to listen and try and embrace and move forward with some of the new models that are emerging.
So the fight is on for what's in their best interest.
And Michele is at the Alexandra Hospital in Redditch right now. How significant, Michele, is this report?
Oh, it's extremely significant. Everything is now on a knife edge. The commissioners for Redditch and Bromsgrove say they have put their jobs on the line, saying what they have, but they don't want 16,000 elderly patients having to go to Worcester if the emergency department here remained unsustainable. On the other hand, Worcestershire Acute Hospital Trust needs to make changes because the Alexandra Hospital services aren't sustainable and there are financial pressures that the trust is under. I'm joined now by Neil Stoke from Save the Alex, who I really want to get your reaction to what's actually happened today.
Well, isn't it sad that after 4 years there is still not a model which Worcester Acute Hospitals Trust can put in place which is safe and sustainable? I think that's a damning indictment of this process and shows that they should be looking at all providers and not just what this trust can actually do.
But this is a wider issue and we're talking about the whole of Worcestershire here. If you go UDI and if you move away, what does that actually mean for the rest of Worcestershire?
Well, that's the big unknown. What it actually could mean is better services for Worcestershire as opposed to Redditch and Bromsgrove people having to travel to a hospital which is too small, can't cope, and would leave this hospital with an unsafe A&E. That's what the report says. That's what the A&E consultants who resigned say.
What do you want to happen now? What do you have to say to your MP and to the governing body?
Well, to our MP, I say this. You said it was safe before the election. It's clearly not. Hold a public meeting and tell us what you're going to do. And to our GPs, vote in favour.
Okay. Well, the governing body meets tomorrow and we'll find out after that what the future holds.
Well, Michele, thank you very much indeed. And earlier, I spoke to the Redditch MP, Karen Lumley. I began by asking her whether she accepted the findings of these independent experts.
I have to say, Michael, today I'm pretty disappointed, but it's not a surprise to me. There should be 16 consultants at both our hospitals and there are 6 for the paediatrics, so it's not a great surprise to me today for that. And as a mum myself, would I want Redditch mums to go somewhere that the consultants are saying not safe? No, I wouldn't. But I want to make sure that, you know, young mums who are having babies can go to the Alex for their appointments, and if that means that we have to do collaboration with other hospitals, such as the Birmingham Children's Hospital, then I think that's what we should be looking forward to doing now.
But these experts, who they say they have 400 years of clinical experience between them, they're not only saying it's not safe, they're actually saying a lot of these services should go to Worcester. Do you not accept that?
I think what they're saying is that, you know, certain services do need to go to Worcester, but what I want to make sure is that my mums can go to the Alex to have their appointments with their consultant. If it turns out that it's not safe for their baby to be born at the Alex and they have to go to Worcester, then obviously I'm not a doctor and I have to accept that.
If there was no end of money, there would presumably be no problem. This decision is down to the funding they've got, and the funding is ultimately decided by the government you support.
I don't think this is all about money. I think this is about a lack of consultants in our country, and I think that's something that as a government we are starting to address. We are trying to get 5,000 more GPs into our system. Simon Stevens has put forward a 5-year plan that says we need 8 billion. We've committed to that money.
There has to be a point where you say you can't afford to eat everything at every hospital. It does come down to money, and changes have to be made.
I think it comes down to money and changes. I think it's important that, you know, we've seen stroke go to Worcester because it's important that we have specialist services. We saw the footballer here in London being transferred past 5 A&Es to go to the specialist hospital. That's got to be right. But it doesn't mean that the Alex has not got a vibrant future. I want to see more services come to the Alex. I want to see the A&E stay at the Alex. I want to see a centre of excellence there, which there is already in neurology.
Right.
And I think it's important that, you know, we have a good hospital in the Alex, and I want to see collaboration with other hospitals around our region to bring more services to the Alex.
Redditch MP Karen Lumley a little earlier, and there'll be